Right.
And over to you.
Thank you. Thank you for that, Zachary. And hello to everybody. Thank you for attending our symposium. As Zachary said, I am Divine Love Salvador, and I have with me a team of clinical psychology researchers and practitioners, and we're all from the University of the Philippines in Diliman. And just to briefly introduce the team, the first presenter is Cheng or Sandy Ang, and she will be presenting her preliminary analysis of the lived experiences of emotion dysregulation of university students. She will be followed by Mr. Jeryl Shawn T, who will then be presenting his study on the lived experiences of perfectionism of Filipino university students, followed by Ms. Jenina Borromeo, who will be presenting her study on the lived experiences of Filipino single working moms and their experiences of role balancing. And last but not least, Tanya Maria Gonzalez will be presenting her study on the therapeutic metaphors in a dance movement intervention for Filipino adolescent girls. So without further ado, let me call on Sandy for the first presentation.
All right, thank you, Dr. Salvador, for that introduction. Good day, everybody. I am Sandy, and I'm here to talk about the research that I've undertaken as my PhD dissertation and to share the preliminary findings that I have come up with so far. The title of my study is Understanding University Students' Lived Experiences of Emotion Dysregulation, a Preliminary Analysis. Now, the main subject of my study is emotion dysregulation. There hasn't been quite a consensus for a universal definition that could capture the essence of emotion dysregulation in its entirety. Many conceptualizations in the literature were based on objective self-report instruments to measure the lack of adequate emotion regulation in isolated individuals, usually typically leaving out aspects of situational, cultural context and transactions with one's environment. However, across the several years of my exchanges with clinical clients struggling with mental health conditions, emotion dysregulation appears to me as a phenomenon that is very personal, subjective, and experiential, such that objective self-report measures could not adequately capture. It is multifaceted. Aside from that, regardless of their diagnosis, there seemed to be this underlying struggle with the experience in dealing with the emotions. And I find myself having to process emotional experiences, be it a depressive condition, anxiety, personality disorder, eating disorder, so on and so forth. Therefore, we can also construe emotion dysregulation to be a transdiagnostic factor that is present in different types of mental health problems. So the literature has already repeatedly showed or demonstrated that emotion regulation is a vital feature of or a fundamental prerequisite for mental health, mental well-being, positive well-being, so on and so forth. And on the contrary, the lack of that or the emotion dysregulation has been found to be associated with the onset and maintenance of more than 85% of the DSM-5 mental disorders. In fact, MDD, GAD, and BPD are highly prevalent disorders that have been found to be strongly associated with dysregulation. I could also observe this association in my personal practice. So given that ED can be observed in the struggles of many mental health conditions, there is a need for a transdiagnostic conceptualizations of emotion dysregulation across various psychopathologies to expound on the interplay of deficits in the emotion regulatory processes. So with this in mind, I started to conceptualize my research and came up with the following objectives. I wanted to know how is it like for our university students to experience ED, in short, emotion dysregulation. Hence, it was my goal to document the narratives of personal lived experiences of ED among UPD students diagnosed with either MDD, GAD, or BPD, the three commonly encountered illnesses in our students. With that, I also want to understand how these students perceive their experiences, find out how, all right, ED manifests in each of these identified types of mental disorders, and to determine how they contribute to the development of the condition and maintain the condition. And finally, the goal is to evaluate the significance of ED as a transdiagnostic factor in psychopathology and how ED would affect the various aspects of the person's functioning. Hence, this study employed qualitative research design because emotion dysregulation is regarded as a highly personal, subjective, and experiential phenomenon, and it would benefit from methods that uses in-depth inquiry to yield insight into its phenomenology. I use the methodological framework of the IPA for its ideographic focus to understand how the person in his or her given context makes sense of the phenomenon of ED. Specifically, I could look at the naturalistic descriptions of the lived experiences of ED in these students. And the IPA is interpretative in nature, such that the understanding of the phenomenon is derived through interpretations from both myself, the researcher, and the participant. The study also makes use of a semi-structured interview as the ideographic method to achieve elaborate, in-depth, and detailed multiple single cases inquiry. Finally, the analysis of the data is analytic and interpretative that involve descriptive and conceptual theme development. Research participants were identified and recruited based on a purposive sampling. A total of 12 students from the UP Diliman campus were successfully screened and recruited. So these are their demographics information. To be eligible for the study, the student has to meet the DSM-5 criteria for any one of the three identified psychological disorders, namely the MDD, GAD, and the BPD. And here are the distribution of the number of participants in each of the groups. All right. The research also include or have exclusion criteria such that individuals or the students that has more than one mental disorders or comorbid disorders will not be eligible for the study. In addition, they would have to have a reliable internet connection because data gathering was conducted over a video call on a Zoom platform. And finally, those who have had prior or ongoing interventions were not eligible for the study. All right, so the research procedure began with the advertising and the sign-ups, followed by a diagnostic screening procedure wherein one-on-one interview sessions were conducted using the SCID, which is the structured clinical interview for DSM-5, to identify individuals diagnosed with MDD, GAD, and BPD. Those who were ineligible were invited to come back for a debriefing session wherein the diagnostic results were given to them and recommendations for further professional help were given to them as a guide for their to help them with their conditions identified in the screening procedure. For those who are eligible, they go through a 90-minute semi-structured interview via Zoom call wherein data were collected for the purpose of the research. And following the research interview, an additional 30 minutes was spent on therapeutic processing to address any distress that has come up during the interview process and also to give them psychosocial support. Furthermore, guidelines and recommendations for further psychological help were also given during this process. As data analysis is still underway, I will be presenting the preliminary findings from the analysis of 8 individual case narratives from the MDD and the BPD groups. To prepare for the data, so all narratives were transcribed, and the analysis followed the IPA 6-step unidirectional analysis process that begins with the reading and rereading, followed by the initial note-taking of conceptual ideas, followed by the development of emergent themes. And then I start to generate subordinate themes. And then I repeat the process for the individual analysis for the rest of the group until all 8 cases have been successfully analyzed. So this is regarded as the individual level of analysis, treating each individual as an individual case. Following that, I created a master list of group level superordinate themes and compared them within groups and between groups to identify superordinate themes that either converge or diverge across the cases. Right? So here is the data. The experience of emotional dysregulation were found to converge across all participants in 4 major dimensions of experiences. So all participants feel very strong and numerous negative emotions that manifest with physiologic reactions, overwhelming thoughts, and outward expressions of felt emotions. They were unable to exert control to reduce this intensity and behavioral outbursts. They were also experienced in the form of impaired modulation and inadequate skills application, such that they used ruminative style of thinking, lack of knowledge and skills for adaptive emotion regulation, poor emotional awareness, communication, and understanding were highlighted. In addition, there were themes that also point to the use of maladaptive emotional avoidance strategies like distraction, avoiding emotional triggers, and suppression. And these all contributed to prolonged experiences of negative emotions that is also part of emotion dysregulation. And it then culminated in a low engagement in goal-directed activities in order to maintain functioning and productivity. In other words, there were low functioning and productivity when they were dysregulated in their emotional experiences. So while participants in both groups lived through their experiences in converging ways, there were also qualitative differences in how they experience each dimension. So the differences are highlighted in this matrix. So we could see, for example, the individuals in the MDD group had clouded thoughts compared to those in the BPD groups, wherein their thoughts are mainly self-deprecating and negative with urges to self-destruct. In terms of the loss of control over their behaviors, people with BPD gives into the emotional urges and become physically aggressive and self-destructive, whereas people with MDD tend to just lose control over their behavioral expressions. In terms of impaired modulation, individuals with MDD were not able to use the usual repertoire of strategies that they used to use, whereas for borderline participants, they had absent thought regulatory strategies and they were not able to identify their triggers. In terms of their maladaptive strategies, individuals with MDD tend to suppress their behaviors, whereas those with BPD tend to emotionally detach themselves or suppress the thoughts. So both had negative outcomes where MDD would have temporary relief but no solutions to their problems, hence prolonging their low mood, eventually leading to a depressive condition. Whereas for borderline personality, there is a buildup of emotions and frequent emotional breakdowns that is also typical of the symptomatology of borderline personalities. All in all, both would have low engagement in goal-directed activities, but in the case for the BPD, they tend to lose energy because of their physical, mental, and emotional exhaustion from the emotional breakdown. Right? I would also like to highlight that there are various present life contexts that are unique to the participants in both the MDD groups and the BPD groups. And these life contexts differ such that ED, the emotion dysregulation, were able to interact with this context to cause the development of symptoms. So for the MDD group, there are ongoing problems that serve as a stimulus that brings out emotion dysregulation, and uniquely found in the MDD group would be living at home would cause an increased exposures to their family and having the pressure to conform to family standards and expectations, and at the same time experiencing academic related problems and struggles. Secondly, there are personal characteristics that are unique to people with MDD that interacts with the original ongoing problems. So these are the vulnerabilities of the self, the sense of self being threatened whenever they're exposed to their family, and their perceived low emotion regulation, self-efficacy. So these makes them more vulnerable to the fact that they are exposed to their ongoing problems. And thirdly, there are conditions within and outside of them that interacts with dysregulation, emotion dysregulation, and eventually shape it into disorder-specific responses. So these include challenging family dynamics, particularly, critical and invalidating family members, negative conceptions of emotions, and low emotional support from friends. All right. Similarly, for individuals with BPD, there are ongoing environmental stressors that serve as stimulus. So these include virtual social interactions that are stressful for people with BPD, emotionally reactive family members, and academic obligations, including their demands. Right, so these are the various personality characteristics that were found to interact with or reinforce the strength of the ongoing stressors, which is the negative sense of self, the threats to the sense of self, emotionally vulnerability, and perceived low self-efficacy in emotion regulation. In terms of conditions that interact with ED that brings out the symptomatology of BPD includes ambivalent family dynamics, close, trustful, but emotionally reactive, unstable interpersonal relationships, attitudes and conceptions of emotions that are negative or ambivalent, and having ideals for friends and friendships that couldn't be fulfilled by their social group. All right. So in summary, all right, this study has been quite successful in meeting its objectives. So we were able to elucidate personal experiences of ED. We found that all participants were able to converge in the experience of ED in 4 main dimensions. And regardless of the diagnosed conditions, there is a lack of awareness and understanding in terms of the emotions. The participants also diverge qualitatively in the way they experience these dimensions. In addition, there are perceived low efficacies, and that they recognize that they need to learn adaptive emotion regulatory strategies. And there are several characteristics and conditions in their present life context that interact with the ED to shape into disorder-specific responses. So all in all, these results showed that we did successfully apply a unifying transdiagnostic model of emotion dysregulation to explain how it can be a common causal mechanism that underlies the development and maintenance of MDD and BPD at the very least. I would like to end with some noteworthy significance for this study. As discussed at the start of this presentation, ED is a phenomenon, but it has been studied using self-report objective tools. So a major breakthrough is that the methodological use of phenomenological approach to study emotion dysregulation allows us to deeply understand the participants' personal experiencing of their dysregulation when it hits them. The use of reflexivity, both by myself and the participants, allow us to interpret the different perceptions of the experiences. And in fact, the participants commented that The interviews questions actually help them reflect deeply into their experiences, and they were not able to do that without those questions. So insight and knowledge were gained on their end. Secondly, the use of clinical training and therapeutic skills had made the research process more therapeutic for the participants. So at the end of the research interview, the participants would tell me that they felt good, that it was therapeutic for them because they were able to gain an understanding on how to process their emotions. Hence, they were encouraged to learn more techniques, to learn more ways to process their emotions in this manner. The resulting framework from this study can serve as guide to develop more practical and cost-effective intervention programs that can be transdiagnostic and therapeutic in nature. And I've also applied that in my own practice. And finally, this encourages the use of transdiagnostic paradigms to study the emotion dysregulation. I just want to note the one limitation. There is a cultural difference that exists between myself and the participants in terms of language. I'm originally a Singaporean, migrated to the Philippines. Hence, the cultural difference became apparent during the research in the aspect of language. So while I tried to minimize this difference by selecting participants who could speak the language, English, I still find that no matter how proficient they are, certain ideas, nuances, and essence of their experience could only be captured in their native language. So the advantage of a ideographic method in the qualitative design is I allow them to express the ideas and then ask subsequent questions to help myself clarify my understanding of what they said. So this gives me an in-depth understanding of their experiences. All right, so with that, I would like to thank everyone for listening, and I hand over the
Thank you,
discussion to the
Sandy.
next presenter.
Yeah. Next we call on Jeryl. Go ahead, Jeryl.
All right, thank you, Sandy and Doc Div. So good day to everyone. I am Jeryl Shawn T from the University of the Philippines, Diliman, and I'll be presenting my study entitled A Phenomenological Study of Filipino University Students' Lived Experiences of Perfectionism. So perfectionism is commonly associated with striving very hard to reach high, unattainable, and unrealistic goals or standards. There's consensus in perfectionism literature that both childhood and adolescence are important periods in the development of perfectionism, with much attention being given to both family and school context. Unfortunately, research has also shown that there's strong evidence in favor of perfectionism as an amplifier of risk, given its associations with negative mental health outcomes. So this leads to the significance of this study. So a reason for doing this study is that there are anecdotal evidences that a number of our students sought counseling with our mental health task force, which is the UP Diliman Psych Serve, because of perfectionism-related difficulties. So there's indeed this concern with perfectionism in our university, so there's indeed to address that concern. And another reason for doing the study is that there is this need to understand perfectionism in a cultural context, particularly the Filipino context. So for instance, there are limited qualitative studies that examine Filipino perfectionism. And I also noticed that a lot of qualitative perfectionism studies were conducted based on well-known perfectionism models that do not really consider culture in its conceptualizations of the phenomenon. So given these reasons, I decided to conduct a phenological study to understand perfectionism among Filipino students in our university. So what you can see on the slide are the study objectives, which includes making sense of perfectionism, salient experiences or characteristics, development, influence, and management of perfectionism. So for the study's methodology, I interviewed 10 participants from our university, and they all rated themselves with at least a 5 out of a possible 7 in terms of being perfectionistic. Now, this is to note that in order to open the interviews or the conversations to teams that are relevant among Filipino students, I chose this sampling method instead of sampling participants based on their scores from well-known perfectionism measures. And you can see on the slide the other characteristics of the sample. So the study's data collection process was divided into 4 phases. I'll just mention each of these phases quickly. So we have the pre-testing phase, where I conducted a pilot interview and a debriefing assessment. And then the selection phase, where eligible participants who met the selection criteria were contacted by me to discuss the interview. And then during the actual interviews, I partook in a conversation with the participants to discuss or to understand their experiences with perfectionism. And after transcribing the interviews, I performed thematic analysis to identify the main themes and its sub-themes, and I also conducted member checks. So when it comes to the results of the study, when it comes to living with perfectionism, it can be summarized into 3 main themes. Living with perfectionism is developmental, dialectical, and directed. So I'll discuss these main themes and its sub-themes on the next slides. So first, perfectionism is not only a construct, but also a developmental process. Throughout their development as perfectionists, the participants exhibited a number of characteristics and many relevant contexts in their lives in order to get order and organization. And these characteristics can be summarized into these 3 sub-themes. So first is high standards. So for instance, a couple of participants shared ultimate life goals that are considered high and impractical, such as to know everything and to be the jack of all trades, master of many. Second, rigidity. So for instance, they needed to ensure tidiness and cleanliness in their rooms, or what they call their personal sanctuaries. And obsessiveness. So for instance, they needed to ensure uniformity of project elements such as font and font size. And a couple of participants shared that they engage in compulsions in order to remove the discomfort that they experience. So this is what we call the just right OCD. There are 3 contexts that are important in their development as perfectionists, one of which is the family context. So meeting parental standards is rooted on their need to help the family, to bring about family reputation, and to showcase their respect and love for the family. But for some participants, it's just a negative reinforcement, since they just want to avoid getting punched by their parents or from their parents. The second important context is the pre-college context, which includes elementary and high school. So their pressure to achieve and to succeed further can be attributed to contextual features in the pre-college environment. So for instance, there are features where they emphasize more on performance and competition over learning. And finally, college context. So they started to reject the pressures of perfectionism because of turning points that they experienced while in the university. So for instance, they were exposed to very difficult coursework, and they interacted with students with comfortable or greater levels of intelligence and skills than them. Second main theme is that living with perfectionism is dialectical. So participants had to deal with constant negotiations and trade-offs with regards to their perfectionism in 2 ways. First is the push and pull of standards. So they struggle to engage in different perfectionism orientations concurrently, particularly when it comes to meeting both their own standards and the standards of others. And the other negotiation or trade-off they have to deal with is it's with the double-edged nature of perfectionism. So all of the participants agree that perfectionism has become a lifesaver in their lives because of the advantages that it brings, such as academic success and future success. But they also understand that perfectionism demands sacrifices because of its disadvantages, particularly when it comes to their relationships and their mental health. So this is a quotation from one of my participants, where she said that perfectionism is a good skill or ability across many aspects in life, but it is like a ghost that you have to shoo away. So this quotation highlights the susceptibility of the participants with regards to the paradoxical effects of reaching or pursuing their goals or standards as perfectionists. And the last main theme is that living with perfectionism is directed. So the participants are continuously engaged in being motivated to fulfill their goals as perfectionists. And what's interesting to note based on their narratives is that their motivations as perfectionists can be associated with the type of acceptance scoping that they use, and hence their experiences of mental health outcomes. So first we have active acceptance, which is acknowledging a negative, difficult situation and dealing with it constructively. So participants whose primary motivation is to fulfill their own goals, they are likely to use active acceptance, and thus they're also likely to experience more positive outcomes than negative ones. And then we have resigning acceptance, which is similar to active acceptance, but this time it is coupled with pessimistic and passive behaviors, cognitions, and emotions. So participants whose primary motivation is to fulfill the goals of others or to meet the standards of others, they primarily use resigning acceptance and thus are likely to experience more negative outcomes than positive ones. So this theme, together with the second main theme, emphasizes the difficulties or the challenges in managing one's perfectionism, primarily because it is a mind game. But in the face of these obstacles, the participants hope, and they actually have this optimism that they'll still be able to balance the standards, to balance the consequences brought by the perfectionism, and to draw a line to make it more optimal for them. And with that, let me provide some discussion points that I'll be sharing today. So first is with their experiences and characteristics. So their experiences and characteristics as perfectionists are not really different from the ones found in cross-cultural perfectionism studies and in well-known perfectionism models. Despite this, future studies can compare relationships and effects of perfectionism across cultures. So for example, there is this well-known dimension called socially prescribed perfectionism, which is basically the need to meet the standards of others. And what we know from literature so far is that socially prescribed perfectionism is considered an adaptive dimension in collectivistic cultures, but a maladaptive dimension in individualistic cultures. Second discussion point is with regards to the contextual features in the pre-college environment. So this places major implications with regards to the students' academic growth, or academic development and personal growth, as they lack the resilience to embrace mistakes or failures, as their self-concept is highly contingent upon getting high grades and getting a lot of achievements. This also places questions with regards to the role of perfectionism in today's educational philosophy, in terms of, for instance, developing their curricula or competition with other schools. And my last discussion point is with regards to the clinical significance of the study. So after conducting the interviews, I realized as to how the interviews can actually be very therapeutic for the participants in processing their perfectionism experiences and standards. So let me give an example to this. So it's not surprising, especially in the Filipino context, that parental relationships or interactions are very important in their development as perfectionists. Before they entered college, most of the participants learned to adjust their behaviors according to parental standards. And in Filipino psychology, this parental relationship or interactions are essentially at the surface level, or what we call the outsider level of social interaction. And according to Porcadas, those who are guided by these interactions, they still feel shame and they still feel the need to be accepted. However, as I went through, or as I processed their college experiences through the questions that I asked them, the participants realized that it's not just about fulfilling their own goals during during their college time, such as fulfilling their goals of competence and autonomy, but they also realize that meeting parental standards is something beneficial for them. Not just in college, but for their future as well, especially as they graduate college and face the real world. So, in other words, they realize that their parental relationships or interactions can actually shift from an outsider level to what we call a one of us level of social interaction in Filipino psychology. And according to Porcadas, those who are guided by the one of us level of social interaction, they have increased levels of self-esteem, satisfaction, and fulfillment. So this places importance with regards to the interview process, as the participants were able to realize something about their perfectionism experiences and standards that they did not fully realize prior to the start of interviews. And let me add one more thing, which is the significance as well of family communications. So for instance, the child and the parents can actually discuss and talk about expectations, standards, and maybe to find some balance, or to find the right compromise with regards to meeting standards, particularly when it comes to the child or the student. And with that, let me provide to you a couple of limitations for the study. So this study did not include interviews of relevant institutions of the perfectionist students, like the family and the school, because of time and coordination concerns. Another limitation is that the findings may not present an accurate understanding of the sample's experience of perfectionism, as the study relied on self-reported data. So for instance, there are difficulties in recalling experiences in the development of perfectionism from a couple of participants. And finally, because of the sample's characteristics, there are generalizability concerns, so future studies can concentrate on samples with other characteristics. So this is the end of my presentation. Thank you very much, and I'll give the floor now to my colleague, Jenina. Thank you.
Thank you, Jeryl. Let's call on Jenina, but while she's preparing, I just wanted to briefly note that the first two presentations were about what we would consider to be clinically significant experiences that clinical psychologists often work with in therapy with their clients. The next two, part of our work, our work covers a wider range. So part of our work is also to sit with our clients when they're in distress, or when they're grappling with important life concerns or problems of living. So the next two presentations will give us a glimpse of such important concerns. Jenina, let's start with yours.
Okay, so hello everyone. So my study is all about the role balancing experiences of single working mothers. So next slide, please. Okay, so the research objectives for this study is essentially to understand the constructions and experiences of working single mothers in balancing their career and then parenthood. It also aims to understand how resilience and parental self-efficacy play a role in the working single mother's experiences of balancing their roles. So for this study, we have participants, single mothers who are aged 22 to 40 years old, who are also working full-time, whether office or field-based. I did not include those who are working at home or working from home, because that is the limit. That is also part of the study. Okay, so for the instruments, we have I used essentially two scales: brief resilience scale and then brief parental self-efficacy scale. I also added guide questions based for the one-on-one interviews based on Prince 2009 study on role balancing. And then for the research design, I used qualitative research design and then obviously thematic analysis. So for the data gathering, for the first part, there was a survey questionnaire. So this was distributed among the participants who qualified within the criteria. And then the second part is the one-on-one interviews with the selected participants from the first part of the data gathering. So in essence, there were a total of 7 participants for the one-on-one interviews, and they were grouped into 4. So 2 participants were grouped into the high resilience and high parental self-efficacy group, and then another 2 in the high resilience and low parental self-efficacy group, and then the third one also 2 more for the low resilience and high PSC, and 1 for the low resilience and low PSC. So I will explain later some challenge that I encountered with the data gathering process that also somewhat had some impact in the results. Okay. So here is the conceptual framework. Essentially, we have here the roles, mother role, worker role, and then these are influenced by resilience and the levels of resilience and parental self-efficacy. Within the roles, there's also role conflict between and within the roles, and then role enrichment. And all of these are influenced or affected by contextual or environmental factors. So, and then for the results, here are the results. We have 3 important themes: ideas in motherhood and work. We also have good mother versus good worker dilemma. And then the last theme is potential positive and protective factors. So, okay, so for the ideas in motherhood and work, essentially, just a quick explanation for this. What the participants' experiences revealed is that they transformed their motherhood ideals into the demands and goals in their mother role, and that's the same also with their worker role. However, it was more like definite in terms of their worker role because their job description is there, they know what they do with their job, etc. But with their mother role, it was more of influenced by their own ideas as well as the ideals of the society and other people influencing those. And then essentially for the participants in this study, being able to meet the perceived demands and goals in motherhood and work leads to perceptions that they are also able to live up to their good mother and good worker ideas. Also, living up to these ideals would not only be beneficial for their children, but is also crucial for them because if it uplifts their single parent status and elevates their appraisal of their identity as a working single mother. This is important to note because like in the Philippines and other maybe Asian countries, the traditional parents, like having the mother and the father in the family, is still the more dominant form of family structure. Okay, so we also have the good mother versus good worker dilemma. So while the parents, the working mothers, work in order to provide for their children, work becomes somewhat a hindrance in performing their mother role because they cannot attend, for example, their children's activities in school or other related to childcare activities. So essentially, these women wish to tailor their working lives around the needs of their family because career growth, having like higher salary, more flexible working hours, will allow them to sacrifice less and prioritize more their mother role, thus resolving this dilemma and hopefully eventually leading to perceptions of good general role balance. So that's it. And then for the potential positive and protective factors, I identified 2. So we have situational factors. The circumstances that they're living in affects also how they balance their roles, as well as the social support at home and social support at work. So at home, it would usually be their family members because most of them are living with their parents or siblings. And then at work also, very supportive bosses or supervisors or co-workers are also helpful in allowing them some sort of flexibility or leeway somewhat in their work environment. So That's it. And then lastly, there's the strategies and resources in role balancing. So they also do time management, stress management, financial management, as well as self-care strategies like going to the spa or resting or sleeping, etc. All of these are also very helpful in balancing their roles. So, and then lastly, personal causation and disposition, very important that these women also exhibit determination, motivation, dedication, strength, independence, openness to change and growth. And these are very helpful in allowing them to counter to get through the struggles that they face as working single mothers, because as the study concluded, it's inevitable that they face these challenges. Okay, so the results for role balancing in general. So for the within role balance, okay, majority of the participants believe that they can manage the demands for each role. However, they believe that they can generally manage the demands of the tasks at work better than in motherhood, obviously, because again, tasks at work are very definite compared to motherhood. And then next, for the between role balance, majority of them experience some form of negative spillover, meaning one responsibilities in one role affect how they perform in the other role. Okay, but positive spillover was also observed. And then lastly, for the general role balance, majority of them again believe that they are still able to perform the responsibilities in their dual roles, but they have to make sacrifices and trade-offs given the, again, challenges that they continue to encounter. Okay, so next, please. So maybe I'll not discuss that anymore. Next, to give time. So for the conclusion, essentially, the participants in this study indicated that they have what can be described as adequate role balance, since most of them admitted that they cannot really balance their roles as competently or effectively as they would want to. And then looking at the four groups, going back to the levels of resilience and parental self-efficacy, there was little to no significant difference in their role balancing experiences. However, low levels of resilience and normal levels of parental self-efficacy in conjunction with financial constraints may be linked to perceptions of role imbalance. On the other hand, high levels of resilience and high levels of PSC in conjunction with adequate social support and economic resources could result to experiences of having role balance for these women. So notes on this, for this study, the use of the qualitative method, because the first part was a survey essentially, so there were scales that they had to answer, and there were challenges in incorporating that in how to, because the study is mostly qualitative, so we had to make adjustments in terms of how to approach the second part of the study. So we had to make adjustments also in how we identify the participants. So if there will be further studies regarding this, it would be good to have more participants so that that could address somehow the issue with the scores in the initial part of the study. But despite these challenges, the initial part of the data gathering processes, the one-on-one interviews, the qualitative part of the study actually provided or generated rich data, particularly in how these women perceive and interpret their experiences as both mother and worker. So yeah, that's it, I think, I guess. So thank you so much.
Thank you. Thank you, Jenina. And now, of course, last but not least, let's call on Tanya for her presentation.
All right. So hello, everyone. So I'm Tanya. And of course, I'm also glad to be here with Dr. with my colleagues, and also all of you. So, you know, in my work with adolescents with histories of abuse, oftentimes they've shared how, you know, they are ashamed to verbalize their experiences. And the expressive arts, body work, and dance movement approaches allowed us to have this space for them to explore and express what they cannot easily express through words. So we entered into this world of symbolism so that they can reflect and make sense of their experiences. So this study really just explores how the use of metaphors in dance movement intervention can bring healing through adolescent girls with histories of sexual abuse. Okay, so the focus mainly was to identify therapeutic metaphors that emerge in the session. So This can be from the therapist, from co-construction between the participant and the therapist. And we also wanted to look at the participant's personal process as they go through the dance movement session. And we always ask, why choose a qualitative research, right? So because qualitative methods actually provide a better understanding to the types of metaphors that are helpful, and also the processes that adolescent girls with histories of sexual abuse go through. So this can even offer some insights to future interventions for adolescent girls with histories of sexual abuse. And also it can even offer some input in terms of using dance movement and metaphor therapy approaches. Okay, so these are just our main constructs. The constructs of this study are the therapeutic metaphors and the participants' personal processes. So the therapeutic metaphors really pertain to the symbols and images in the body and movement. So these are the ones that hold meaning and significance to the participant. So this is something significant. So throughout the intervention, there were actually a lot of metaphors that arise, but the only thing we want to focus on are the metaphors that are important to them. So these are the ones that are helpful for them in understanding and making sense of their experiences. Second, of course, is the process. So, this is the process that the participants go through in the movement. And to do this, really, I actually was inspired by certain ways of tracking movement. So I was drawn to certain approaches. There was one, Hannah's work in 1999. She used nonverbal and verbal analysis on how to analyze movement. And then it was also Halprin who used a vocabulary for movement. So presenting how thoughts, feelings, and experiences. So, we also created, I created a forum inspired by that, just to record and track the therapeutic metaphors and the processes that happens in each session. And I really just focus as well on the meanings that happen. What was the movement? What was the meaning behind the movement? What was the significance and the impact? So that was the main focus of the study. So finally, we were able to really just process and see this, that, as it transpired during the one-on-one discussion as well as the group sharing. Okay, so this was mainly what I was trying to do in the study. So yeah, so the study just really looks into these, what I was saying, the metaphors and these processes with 8 adolescent girls. So we did a convenience sampling, which was really just selecting a particular shelter that needed an intervention. Okay, so the shelter was the one that we felt like was in need of an intervention. Okay, so all of the girls here are all from the same shelter and they've all experienced sexual abuse. And as you can see, we also have a data gathering procedure. So it's divided into phases. So of course, we first started by meeting the team. And then, after that, we ran the program. So I ran the program together with two co-therapists. And I was the facilitator, but I was also the researcher. And I also had an expressive arts consultant. Okay, and after that, after each session, we conducted group sharing and also individual debriefing, where we can really talk about the process, talk about what was significant to them. What was it that was, how were they moved by it? What were the specific metaphors? What transpired? So there was a lot of therapeutic conversation that was going on also here. While there were actually standard questions that served as a guide for the facilitator, it was really very fluid. No, we also kind of flowed with what was needed at that moment. After that, we also accomplished weekly session notes and weekly journals just to track everything that was that they were doing, and to just kind of see, looking at the experiences of not just the participants and what they were going through, but also for the therapists who were also researchers to reflect on what was going on. And so that we can also, remain objective and catch ourselves when we could, we could be subjective. And then we also went through, of course, transcribing and analyzing in the data, which we also use a thematic analysis. Okay, and it's important also to point that we really made sure the ethics were also taken into consideration. So it was to really protect the girls and also to protect the center. So really disclosing any information about them, we had to make sure everyone was also aware what they were getting into. And another is really one main thing, is really to balance the research objectives with the need to provide support as the participants needed. So in this study, there was a lot of dual role. So the researcher myself, I was also the facilitator and the therapist. So from time to time, I had to be sensitive to the needs of the participants, but also at the same time, I also had to stick to the objectives, right? So there was a flexibility going on to adjust to, the changes that was needed and, looking at what was more appropriate at that moment as well. And yeah, and we also noticed this when participants came to the session with a different mood, or that they weren't up for doing the activity, we had to change and adjust the motion. Right. So, and of course, I had to document this during our research. And these were our main findings. Okay, so what we basically found was that the different types of metaphors, therapeutic metaphors, reflected where each participant was in their personal process. So while the girls went through the standard 8 sessions, not all the girls were at the same pace at the same time. So the sessions were indeed also very personal because the girls can be at their own pace and still create the different types of therapeutic metaphors. So, this is what we're noticing, right? So during the earlier sessions, we noticed that therapeutic metaphors were positive in nature. In the middle phase, we noticed that, they became more negative, and they also started to open up more and became more vulnerable. And at the last phase, after integrating it all together, all their experiences, they move towards acceptance, accepting the past, and developing new positive therapeutic metaphors. So it's important also to note that this would actually not have been easily constructed if the methodology did not value creating a safe relational space in which expression and also personal construction could take place. So it was observed that once trust was established, the participants started to become more open towards immersing themselves in the process. And also there was that beauty of sharing and also witnessing each other help them realize that they're not alone in their experiences. So this is basically what's going on the beginning phase. So this is the first few sessions. So these are some of their movements. We see that all the girls created positive and protective therapeutic metaphors. They came to the session with their walls up, and they really just wanted to be perceived positively so that they behaved, they behaved in their best behavior. They were conscious about their movements. They followed what was going on. And really the goal here was just to make them feel safe around one another. And then, after that, once they felt safe, they started to be more, and they started to explore. They started to open up more and started to explore what was going on. But we can see here in the middle, you can see that there's a hesitation. There's a part that, okay, I'm willing to open up and I'm willing to trust, but I'm not yet so sure. So there's that push and pull. And then later on in the very right, we see them start to move towards opening up to new experiences. So here we see like a certain shift. No? So some of them would be like more playful. They started to make more movements, started to take out their mask. And then later on, they would be more still and sit down and try to reflect what was going on. Right? So there's that need to, let me just give this a try. This is something new. And then we move to the middle phase now. The girls were actually saying that, they started to feel more comfortable in exploring themselves. So now what was going on is that they created explorative and expressive therapeutic metaphors. So the exploration really began with certain, receptivity as well. They wanted that willingness to become vulnerable. And then, as they started to do more and more, is that they started to be more in touch with their true feelings. So we started to see this. So in the middle, you see that more movements were more forceful, and really it involved bigger movements involving their heart. So really just expressing that. And in the last picture on the right, we actually see them and reenacting what happened when they were at their hearing about their case and with their perpetrator there. So it was really a chance for them to see it in a different light and a chance for them to come back to a painful experience and actually express that and really tell their story in coming back to it. So for them, it felt like they felt at ease to be able to do that. And they felt safe saying that, it's good to see that I'm not alone in this, and also see that I have the support of one another. And now I can see it in a different way as well. And of course, the last phase was the transformation phase. So in the end phase, really you're just brought back to their experiences and what have shaped them to becoming who they are. And if you can see, as a summary, we see the progression. We see the progression from the beginning phase where they started with simpler metaphors that were more positive and protective in nature. And then in the middle phase, we see them now becoming more vulnerable and becoming more aware as they express their pains and issues. And then we end with really accepting their experiences and really gaining an understanding with themselves and their experiences. Okay, so just a brief point that I want to make. These are just some key considerations which I think all of us really were focused on, is that to integrate our clinical perspective in qualitative research. Now, so we're seeing here is that there was really a need to balance that relational aspect and the discursive context. Now, so we're seeing is that, each therapist had the therapeutic relationship. At the same time, we had to stay true to the methodology and also stay objective. And at the same time, this is also why we're seeing the therapist's role. Okay, so we play an important role in shaping the narrative. So we always had to kind of check in with ourselves and also see that how is the therapist impacting. Now, sometimes we could see that if the therapist is also very therapeutic and very present, then it's helpful. But sometimes there could be premature explorations that may not be helpful. So we also need to be mindful of our own beliefs, our own values, our own issues and thoughts at that moment, so it will not get in the way of really facilitation. And of course, last is really the flexibility and sense of urgency to intervene at any point of distress. So we noticed this. If there were instances that we needed to change or we needed to do something that was unplanned because it was relevant at that moment and it was helpful, we had to do so. And I think it was mentioned by one of the therapists is that it was a realization that it was the therapeutic experience rather than focusing on accomplishing the goals set for them actually was helpful for them. So that was our being focused. And so last, I want to conclude with this is that I saw that it was actually very helpful. So coming back to the shelter 2.5 months after, they said that there were changes in the girls' behavior. They related more to each other. They also had they had more positive thoughts towards themselves. And it was actually that comfort to actually talk about this. And we also saw that in doing this kind of work, it's more helpful and more relevant to really focus on the theme employed dimension. So what is the theme? What's the process exactly? And what's the emotional tone? So this was really the feelings, the emotions, and the meanings that each movement carried. Okay, so that's all. So we thank you for listening to us. I'll give the floor to Doc Dev.
And thank you, Tanya. We're just at the hour. But that means I'm not sure that we're able to take any questions, but I hope that our audience, all 33 of us, did get some important insights as to the potential of using qualitative methodology in clinical research. Thank you very much.
And thank you all for joining us and making these contributions on a very wide variety of subjects, from emotional regulation, dance therapy. I'm sure that a lot of different people have things they can draw on and learn from this.